Hey y'all, come with me to learn how to use NARCAN. Health Center in the Portland neighborhood, and I wanted to learn more about how to use Narcan. I've shared with y'all many times before. When I was a teenager, my brother was 12. My mother died from an overdose. She struggled with addiction to alcohol and drugs, and there was no support for us. We just kind of on our own out there hoping to make it. And so, it's been part of my life work to make sure that other kids don't experience what we experience. So I want to learn. And I'm going to ask lots of questions that may seem elementary to people who already know, but there are lots of people who have no idea of how to use Narcan, probably never even seen a fentanyl strip. And so as I ask my questions, just remember they're coming from a place of me not being aware, me not knowing, and also other questions that I've gotten from people in the community. So that's where we're going to start. So I'm here with Joe with the Family Health Center. So let me start out, Joe, with learning more about the work that you do. So what do you do?
So I'm an SUD case manager, and I work with our patients to help them out with transportation, housing. We can help with resumes, job searches. We have our medication assisted treatment program, so we can help out with co-pays for medications and things like that as well.
So if I have a medication that's $1,400 and I don't have $4 in my name, what can you do to help?
We're going to see what we can do to help you meet that copay.
Okay.
Yeah, we've just received funds from the opioid settlement grant specifically to address that issue and to help out with people who can't afford their copays. We also will, at Family Health Centers, we're going to try to, if you don't have insurance, we're going to try to see if we can get you qualified for insurance for Medicaid or whatever it is, so that we can get some of that covered as well.
Okay, it's amazing. I'm thinking about some elders in my church who come to me recently about not being able to afford medications. A different situation, but just in general, just thinking about how people are struggling to take care of themselves.
Yeah. And the medications for substance abuse or whatever, they're pretty expensive. They can be pretty expensive, so it's a big barrier to overcome.
Yeah. Well, thank you all for what you're doing to help people.
Absolutely.
So we're out in the street, right? It's 11 o'clock at night, maybe coming from White Castle, who knows? And there's somebody on the street, and we think they're having an overdose, but we're not sure. So how would we know whether or not somebody is having an overdose?
One of the big things is their breathing may be slow and shallow. That's a big thing to look for. You're going to look for if they're responsive, if their fingertips and lips are turning blue or purplish black, choking sounds, gurgling noises, bluish or purple skin. The big thing is going to be the breathing, though. If they're not breathing properly, or it looks like they're struggling to breathe.
Okay.
And they're not looking like they're not responsive.
Okay, so you could have multiple of those signs.
You can have multiple of those signs,
okay.
Yes.
All right. Do you have information, like, is this something I could take a look at that tells me some of the signs?
Yes,
okay.
Absolutely, yeah.
So people can get this from probably most local health departments. I'm in Louisville, as folks know, so Louisville Metro Department of Public Health and Wellness. Folks can get information on signs of an opioid overdose. And so there are 5 signs here that people can look at. Now, take a picture of that and put that up. You can probably find it on their website as well. So, and definitely follow them on socials for more info. Okay, so we see these signs. Somebody's unresponsive, and their skin is turning bluish, purple, or gray, or ashen, right? Not just ashen because they didn't lotion the elbows.
Right.
Which, most of our grandmas would not be happy with that. But they're bluish, purple, or gray, ashen because they're unwell.
Right.
Okay, what do we do?
Well, what you want to do is you're going to take the naloxone or the Narcan out of the package, and this is what you'll have when you take it out of the package.
Okay.
You want to kind of hold it like this, and what you're going to want to do is you're going to want to put your hand under their neck to just support them, and then you're going to put it up their nose, and then just squeeze, and then we'll give them the dose of Narcan.
So this looks like my Flonase.
Yeah,
okay.
Absolutely.
Because sometimes the allergies in the Ohio Valley will kick your butt. So this looks like what I would use. Now, putting it up the nose makes me think about the terrible COVID test, but I took my test, I got my shots. It has to go all the way up the nose, right?
Yeah, all the way up to where your fingernails are at the at the bottom of their nostrils.
It's the irritating part when they turn the Q-tip around and you're like, oh my gosh.
Yeah.
Okay, so all the way up there. Okay. So then you're tilting the head.
Yeah, and I did forget to mention, before you do that, you can kind of check for a response. Take your fist and press it into their sternum, and do that pretty hard because you want them to feel the pain or whatever to see if they're going to be responsive or not. And then when they're not, that's when you're going to go to that next step with the Narcan.
Okay.
You're going to make that decision. Look, they're not responding. Okay. They're not breathing properly. Let's go ahead and administer the Narcan.
And you're going to do that until you're like, I know this hurts.
Yeah.
So if you're not responding because this hurts right now,
then you know that they're in a dangerous situation.
Okay.
Yeah.
Okay. All right. Okay. So we've done this once.
Done that once. Then what we want to do is we want to wait a couple minutes, 2 or 3 minutes, and in the meantime we can give them rescue breaths.
Okay.
Just hold their nostrils, breathe into their mouth. See if we can get the airflow going again.
Okay.
If you wait 2 or 3 minutes and nothing is happening, then you can take another dose of Narcan and do that again.
Okay. Yeah. So you've done it twice.
Done it twice.
But you've waited 2 to 3 minutes.
Waited 2 to 3 minutes. Yes.
Okay. And in that 2 to 3 minute time, you're checking to see if they're responsive.
Right. And you also, what you also want to do, is after you do that, you want to make sure you call 911.
Okay.
And stay with the person, until emergency services arrive.
So here's my question, Joe.
Yeah.
All right. West End, I live in the West End of Louisville. Y'all know I talk about this often. I'm a black woman. I really don't want to call the police, Joe.
Yeah.
It doesn't always end well.
Right.
Okay. Are there other things that I can do?
What you need to do is you need to put the person in a recovery position, which would be they're going to be laying down on their side, have a knee out. And the reason that you're doing that is because if they were to vomit, you don't want them to choke or whatever. So you're going to put them on their side so that their heads to the side and their knees up.
Okay.
So now you could always call 911 and leave if there's something that you're afraid about. Because if you have a warrant or the person has a warrant, the Good Samaritan law is not going to shield you. So in that situation, you're going to have to make that decision about what you're going to do.
Okay. So Joe, you just said, I want to make sure folks are clear. I'm the person trying to be the helper.
Right.
I might have a warrant out on me.
Right.
So then I could be detained.
You could be in jeopardy.
And I could be in jeopardy.
Absolutely.
But I could put them in this side position. Now, do police know that this side position often means it's something, or do you know? If
they should know. The other thing you could do, if you were able to, you could leave a note. Administered Narcan, placed in recovery position, something like that.
Okay. Why is it important to leave a note that you administered Narcan? What difference does it make? Because I've heard that Narcan isn't harmful if you don't need it. So why do you need to leave a note?
Well, you'd want them to know what had happened with the situation. As much information as they have would, that so they can take the next steps or whatever. You're going to want the person who has been administered Narcan. It's going to be in effect for 2 to 3 hours. So you'll definitely want them to know what has happened. Once they come back to consciousness, and if they do come back to consciousness before 911 arrives, you're going to want to let them know what happened, and not to use for 2 or 3 hours because they're not going to get any effect out of it, and also their body is going to have just gone through some trauma. So the risk of an overdose is going to increase again if they go back and use right after using Narcan. Okay. And they're not going to get any of the effect, the high out of it that they would expect from using.
Okay. Because this is
because the Narcan blocks the opioid receptors in the brain.
It's blocking receptors. So it's masking that
it's masking
until okay, and then for about 3 hours you said?
Yeah, 2 to 3 hours.
2 to 3 hours. Okay. And then why is it? So now I'm thinking about medical personnel. Why would it be important for medical personnel to know whether or not someone has been administered Narcan? Is it basically the same reasons? Is there anything in addition?
Yeah, I think it's basically the same reasons. So they know what to do next in the situation.
Okay. Now these are expensive, y'all, and that's why we're not opening this brand new box because it could be used to save someone's life, and we're using the model, the example. Do you know how much it costs to get 1 box of Narcan? All right, so thank you so much for indulging my questions about Narcan. Is there anywhere on site where I can get Narcan?
Yeah, you can actually get Narcan here at Family Health Centers West 2500 West Market. We have a box outside, or you can come inside and get it. You can also get it at the Public Health Department at no cost.
So it's free. If I went out to that box, it's free. No
it's free
cost.
out there at that box. Yes, absolutely.
Okay.
And we monitor that and keep it filled.
I don't have to check it out or anything?
You don't have to check it out. You just come up to the box and grab it and go.
So if you're in Louisville and other places, I've noticed, free little library example, you can get you a book and you can leave a book, right? In this case, you can get you a box of Narcan and you can save a life. All right, so Joe, can you tell me about these strips?
Okay, the first one is a fentanyl test strip. A lot of opioids now are being cut with fentanyl. A lot of times what folks are using is fentanyl cut with something else. So if somebody wants to find out what they purchase, whether it has fentanyl or not in it, they can use one of these drug test strips. Another thing that they are cutting the opioids with, even the fentanyl itself, is xylazine, which is an animal tranquilizer, which is going to cause you to nod off, but it's not going to cause the same type of effects as the fentanyl, the heroin, or whatever. But you can also test to see if there's xylazine in the product that you purchased.
So this is really important, folks, for y'all to know about because these are newer developments. So please pay attention to how best to use these strips for xylazine, right, and for fentanyl. And this is really important for young people who are watching. Is this like if I went to the health department, I could get free condoms? Can you get free strips?
Yes, absolutely. Okay. And you can get them here at Family Health Centers as well.
So you can get them at Family Health Centers as well by getting free condoms. You want to protect yourself? This is a way to protect yourself, okay? So make sure you get some free test strips, both kinds, okay? The strip for xylazine and the strip for the fentanyl. So thank you so much for that, Joe. That's important for people to know.